Now we move to the last one, Jody Harris from IDS. It's on coalitions and transfer of nutrition policy to Zambia.
Okay, so as well as understanding which policies and interventions are needed to advance these synergies that we know are there between agriculture, nutrition and health, we also need to understand how those policies are created and how they're negotiated if we want to turn our research into impact. So that's the premise of this current study in Zambia. So classical policy research sees policy processes as progressing from agenda setting and problem identification through policy formulation and legitimation to implementation and evaluation. And that's obviously rather simplistic and linear, of course. Others say that the agenda setting stage continues with more negotiation and contestation throughout these stages, and that really needs to be assessed and understood. So understanding how actors and stakeholders behave and interact to influence and inform policy decisions is the focus of this study. So in terms of what's already out there in nutrition, earlier policy process work focused largely on food security, or where it did look at nutrition, it didn't really use established policy science theory. And then later work has engaged with policy science largely from public health. And there's a largely separate stream of anthropological policy work in nutrition as well. So my work tries to draw on both what we might call those sort of mainstream policy approaches and critical approaches looking at power among policy actors. So the aim of this qualitative study was to explore how and why certain international nutrition ideas and approaches have found their way into national nutrition policy and practice in Zambia, and therefore to contribute through investigation of that case in one country to an understanding of policy processes more generally. So the study used 70 interviews with 61 respondents over 6 years at international, national and district levels in Zambia, to understand actor aims and their perceptions and beliefs and actions around nutrition policy. And it also used social network mapping to understand their interactions. So this is the social network map that informs the core findings, which I'll show you later. So as my interviews and social network data were explored and synthesized and initial themes were developed, a broad reading of the public policy literature suggested that there were two theories, one of policy transfer and one of advocacy coalitions, that might shed some theoretical light on the emerging empirical findings. So that's what I'm presenting today. So Rebecca gave us a great background on food and agriculture in Zambia in plenary earlier, but there are several major nutrition issues in Zambia. The major issues by numbers are stunting at 35% of children under 5, and hunger at 45% of the population. And this has implications for the different agendas that I'm going to speak about in a moment. So stunted growth in children and multi-sectoral action to address it are obviously, as we know, dominant ideas in the international nutrition community at the moment. And the evidence and interactions and interventions cited in papers like the LANCET series were advocated and funded by the international nutrition community in Zambia, and they're increasingly seen in national nutrition policy after 2008 when the LANCET series was published. But new narratives like multi-sectoral action for malnutrition don't encounter a vacuum at national level. They have to interact with lots of established and emerging ideas and interests and preferences in the different communities in the national policy process. So food security policy to address hunger and nutrition policy to address malnutrition coexisted fairly peacefully for decades, largely because they existed in different realms. So food security was addressed through the agriculture sector and nutrition through the health sector. But that obviously changed when this multi-sectoral narrative arrived in Zambia. And how did this change? So this is a map of the nutrition policy subsystem in Zambia. So it shows key actors in national nutrition policy. So each of the bubbles there is an organization. It shows their influence on nutrition policy and practice. So influence was assigned by respondents and is shown by the size of those bubbles. And any links of accountability between them are those black lines and arrows. And within that network, there are different coalitions with different views on what constitutes the best way forward for food and nutrition policy. So a dominant coalition in the overall nutrition policy subsystem for many decades in Zambia is an influential national group promoting maize production and calorie availability as a core response to food insecurity and hunger in Zambia. It's based largely in the agriculture sector and has strong government support. And two key policies, so a maize production subsidy that's very similar to the FISP that we've just heard about in Malawi, and also a government buying scheme comprise the focus policies of that coalition. And together they have a really high national coverage and they take a very high proportion of the national agriculture budget. And then a newer stunting coalition has emerged in the last 10 years or so, and it's taken its core ideas predominantly from the international nutrition community. It's comprised largely of donors and UN and international NGOs, but also the key government nutrition technical department, the National Food and Nutrition Commission, its parent ministry, the Ministry of Health, and various structures that have been set up under SUN, Scaling Up Nutrition. So this coalition is trying to make nutrition multi-sectoral, as we all know, rather than health sector based as it has been historically for very good reasons. And it's doing this largely through interventions into food policy, through trying to incorporate a section of the agriculture sector. So the two major food and nutrition issues in Zambia, hunger and stunting, are therefore represented by different coalitions of policy actors in Zambia, one on food security and one on nutrition. And that has implications for either coalition in progressing as a coherent policy direction, because in some ways they are logically opposed, particularly on the production of diverse foods, which we know is important for nutrition. So although the beliefs of the two coalitions are closer than they might think, their normative beliefs are similarly sort of socially oriented and pro-intervention in both of those. The policy core beliefs are where the coalitions diverge. So each focuses on a different part of the overall issue, one on stunting and one on hunger. And then the secondary policy beliefs about what should actually be done cascade from those. So either a focus on multi-sectoral action to address all of those complex determinants of child malnutrition, or the task of making available sufficient calories through staple food production. So the Nutrition Coalition has certainly influenced nutrition policy and program agendas in the formulation of written policy in the health sector in Zambia, but it relies more on a sort of moral claim rather than political legitimacy for its interventions. And then the Food Security Coalition has set the agenda of the agriculture sector, and its policies are entrenched really in the Zambian social contract, and politically they're very difficult to change. So both coalitions are successful in getting their ideas into policy formulation and written policy in different sectors and defining those policy alternatives to choose between. But the Food Security Coalition is certainly more successful in having its policies funded and implemented nationally, and those policies win popular support and they win political votes. So three overall conclusions then from that. So the first is nutrition policy has been transferred to Zambia by this global coalition advocating for the current international nutrition agenda. But there may be room for manoeuvre among those different policy coalitions through evidence and dialogue, and really by acknowledging explicitly that these tensions exist between the different groups. So secondly, malnutrition more broadly than calories is an important social and health issue in Zambia, but hunger also is the lived experience of many Zambians. So a strategy that focuses on both is needed if the legitimacy of either coalition really is to be maintained, not this sort of logical dismantling of one issue to promote the other, which we often see with that multi-sectoral narrative. And then lastly, methodologically, policy transfer theory explains why and how new ideas found their way into Zambia's policy. And advocacy coalition theory is a useful tool for systematically assessing actors in the policy network, although it might be limited by its focus on coalition beliefs rather than their interests. But this study found that combining political science theories better explains policy change than using them alone. And these can be used to investigate and understand changes in policy wherever the global community reaches down into low-income countries. Thank you.